I try to treat each patient individually. Everybody has different problems, different demands on their lives, and different circumstances physically. My primary goal is to make a contribution to the quality of their lives, to allow them to return to the activities or other endeavors that they are anxious to get back to, and do our very best to, at the very least, make some positive impact and improvement on their lives.
He made me the life back because he saw what was the problem and he fixed it.
But so far, so good. You're healing. You did great, healed well on the other side. I have faith you're going to do just as well on this side.
I tell everybody to go to Dr. Stone. He's brilliant.
All right, dear.
Thank
it's
you.
great to see you. We're going to plan on seeing you back in 2 weeks.
Yeah, I have an appointment.
Good.
We try to tailor our treatment to best meet each individual patient's needs. So much of what we do is hands-on. So much of what we are able to ascertain from a patient and their physical condition is by actually feeling, touching, manipulating, and getting their feedback, and also allowing them to demonstrate to us exactly what causes their problems, what brings about their symptoms. So we still want to protect you, especially as you're getting back into practicing and more the soccer, but the nice thing is you're not using your hands directly.
Dr. Stone's been great. It's been very informative. Certainly seems caring. He certainly has demonstrated his knowledge, and we feel comfortable with the directions that we've received.
Hold your thumb up like that. Push up against me. Hold up, go up high. There you go. Everybody needs to understand that there isn't a surgery that solves everything, and there's many, many problems, and probably the vast majority of problems that we see don't require surgery. Turn your palm up and then turn it down. Bend your wrist down.
I'm in very good hands. I have real good experience with Dr. Stone.
The treatment of a patient really starts from the very beginning in attempting to figure out their problem, determine what is the main etiology of their problem, and then determine what is, starting from simplest and then progressing to the more complex, what is the simplest way to help that patient with their problem. And even those patients that we do operate on, therapy and the other modalities are very, very important to their ability to recover and have a successful outcome. We do our very best to take care of each patient the same way, and that's the best way possible.